This is Akashavani Mangalore. Dear listeners, June 25 is observed as World Vitiligo Day every year to bring awareness about this skin condition. In this connection, today, Dr. Girish PN, Professor and Head, Department of Dermatology, AJ Medical College and Hospital, Mangalore, will speak on the topic Vitiligo, Truth, Facts and Myths.
On the occasion of World Vitiligo Day, which is observed on 25th of June with the theme of Treating Skin and Healing Minds, I am here to shed light on what vitiligo is, its impact, and how we can support those who live with this condition. Vitiligo is a long-term skin condition characterized by patches of losing skin color pigment. This happens when the color-producing cells, that is melanocytes, the cells responsible for producing melanin, the pigment which colors our skin, hair, and eyes, are destroyed. Think of a melanocyte as a tiny factories in our skin that produces melanin. What happens if these factories are destroyed or shut down? That's what happens in the vitiligo, where the skin color is lost. The exact cause of this destruction is unknown, but it is believed to involve any autoimmune response where the body's immune system mistakenly attacks its own melanocytes. Vitiligo can affect anyone regardless of age, gender, or ethnicity. It often starts with small patches of light colored or whitish skin and can appear anywhere on the body. And these patches can expand over time, sometimes quickly and sometimes very slowly. Vitiligo is often referred to as a condition rather than a disease because it primarily affects the skin appearance without directly impacting overall physical health. However, the psychological and emotional effects can be significant, making it crucial to address vitiligo with compassion and understanding. The research shows that there is a genetic factor to vitiligo. About 20 to 30% chance of inheriting from the parents to the young ones. So it can run in families, showing potential inherited predisposition. This means if your parents or grandparents have it, you might have a higher chance of developing it too. However, not everyone with the genetic predisposition will develop vitiligo. So you need a genetic predisposition and an environmental factor to manifest it quickly. So environmental factors and other triggers also play a role with the genetic background. There is no strong evidence that a diet can cure vitiligo, but maintaining a healthy diet certainly supports overall well-being and improves the immune system, which is needed for repigmentation, that is, to get the color back from the lost color. There are no restrictions about food like consumption of bitter or sour food. On the contrary, many sour or citrus fruits like oranges enable vitality of immunity. Seasonal greens and fruits must be part of our daily food except too sugary diet. If one consumes egg or animal protein, it does not need to be stopped. However, it is best to consume fresh homemade meals and avoid ultra-processed food, junks, deep-fried items with a high glycemic index. High glycemic index means those food which will induce a lot of sugar level in the bloodstream so that it is difficult to handle by the body. So avoiding such high glycemic food also useful in preventing or treating the vitiligo. Avoiding the or consumption of alcohol and stop or abstaining from smoking is also beneficial. What about stress? Can it cause vitiligo? Stress does not cause vitiligo directly, but can aggravate in people who are genetically predisposed, and increased stress levels also impact recovery rates and may delay response to treatment. So carefully handling the stress and preventing stress overtaking us is also important in prevention of vitiligo appearing on the skin. The primary symptom of vitiligo is the appearance of white patches on the skin, and these patches are often first noticed on sun-exposed areas like hands, face, and neck. They can also appear in areas that are not exposed to sun, such as armpits, groin, and around the mouth, eyes, nostrils, and navel. And vitiligo can also affect hair, as the hair is colored make it to turn whitish or prematurely gray. It's important to note that vitiligo is usually not painful or itchy. The skin underneath the white hair may also become white. So it's important that white hair on the scalp needs to be getting examined by a dermatologist. Look for any whitish skin underneath the roots of the white hairs. How about the progression and types of vitiligo? As vitiligo progresses, the patches may become more extensive, merge with others, or new patches may appear. The rate of spread varies greatly among the individuals. There are different types of vitiligo based on the distribution of the patches. It can be localized to one or two places, and then it is called as localized vitiligo or focal vitiligo. If it is there all over the body, then it is called universal vitiligo, where majority of the body surface has lost its color. Then you have segmental vitiligo, where the patches, white patches, appear on one segment of the body. Example, one half of the face, one half of the chest or abdomen, one part of the leg, left side or right side of the limbs. So it is called segmental vitiligo. A non-segmental vitiligo is another common type of vitiligo where patches appear symmetrically on both sides of the body. How about association with other autoimmune diseases? As we all know that vitiligo is an autoimmune disorder where our own immunity acts on the melanocytes, those pigment producing cells. Patients or persons can also have association with other autoimmune diseases. The most common autoimmune diseases associated are thyroid disorders, type 1 diabetes, alopecia areata, a type of hair loss which is affecting scalp or beard or any other part of the body as small roundish patches which can enlarge to the rest of the body. This doesn't mean everyone with vitiligo will develop these conditions, but a regular medical checkup are important for early detection and management of potential health concerns. What about suffering in vitiligo? Do these patients with vitiligo really suffer? While vitiligo itself does not cause physical pain, the emotional and social impact can be significant. Imagine meeting someone who has vitiligo. At first, we notice the vitiligo patches or white patches on their skin and may have some hesitations in mind if there is a stigma. But as we get to know them, we see their personality, talents, and kindness shining through. Many with vitiligo face social stigma, discrimination, misunderstanding, which can lead to anxiety, depression, and low self esteem. It is essential to provide support and understanding to those living with vitiligo. Now, with respect to diagnosing vitiligo, patients or people who have this white patch need to visit a qualified dermatologist and get themselves examined physically, and then we have a special light called as Wood's lamp which emits ultraviolet light which is better visualizing the depigmented patches. Thus Wood's lamp is an ultraviolet light which will be helpful in differentiating white patch of vitiligo from other conditions. This examination needs a dark room for a better visualization of the patches. Unfortunately, vitiligo is sometimes confused with leprosy, which is an infectious disease. And it's an infectious disease caused by a bacteria which has manifestation as white patches with sensory loss and treatable by proper medication and curable as well. Vitiligo is not a curse nor a result of an evil eye. Education and awareness programs are crucial to dispel myths and promote acceptance. Several treatments can help manage vitiligo, although results may vary. Options include local application of creams and ointments, maybe steroid, non-steroidal creams, immunosuppressive creams on the patches of vitiligo. It can be specialized creams for sensitive areas like face, eyelids, genitals, like calcineurin inhibitors or tacrolimus or pimecrolimus. Vitiligo white patches can also be treated by light therapy, and is also called as phototherapy, which involves usage of ultraviolet light exposure to the skin, either in the hospital in the ultraviolet machines or direct sunlight. The hospital machines may have ultraviolet A and ultraviolet B type of light tubes for a better treatment than the sunlight, as sunlight can vary depending on the time of the day as well as whether it is cloudy or not. Regarding oral medication, in some cases, oral medications are very effective as to control the autoimmune process. It may involve immunosuppressive oral medication. Patients with extensive vitiligo, where there are only islands of few colored skin remaining, depigmenting creams, that's a cream which reduces the color, can be helpful in making to give a uniform appearance of white color to the person. Now we also have a camouflage system, that is camouflage cosmetics. These are specially formulated makeups that can be used to cover depigmented patches, providing an immediate cosmetic solution. Now imagine somebody has to appear for his marriage or a close relative's functions or to a interview. So this cosmetic camouflage is very useful so that they are able to face the public or to keep up the confidence in performing his or her duties. So this cosmetic camouflage is a concept of covering up the patches with the camouflage cream after matching the color tone and covering with the fixing powder on top. It makes it stable and it will be on the skin for about 7 to 8 hours. It provides a boost for the confidence while presenting oneself in day-to-day activities or on a special occasion. And this makeup should be removed before going to bed, and it can be removed with the help of a moisturizer or a cold cream or a soap and water. The other treatment, that is surgical treatment, includes grafting, that is skin grafting in the form of punch grafting, blister skin grafting, or melanocyte transfer, which involves transfer of a normal looking skin onto the patches of white patch or vitiligo patch. There is another treatment called micropigmentation, which is tattooing. If there is a small patch, like a regular tattooing, a tattooing is done onto the white patch to look like a tattoo. Is the sun exposure harmful to vitiligo skin? While gentle skin light can help the natural repigmentation, but the vitiligo patches are more prone to sunburn due to lack of melanin. Thus, avoiding harsh sunlight and use of a sun's protection is advised to prevent sunburn and skin cancer. People with vitiligo can find support from dermatologists, support groups, mental health professionals, family, and friends. And it is important to create a network of support and understanding in these patients. How about the myths about vitiligo? Some common myths about vitiligo are that it is contagious, caused by poor hygiene, a sign of being unhealthy, and caused by sun exposure. None of these are true, and it is important to note that vitiligo is not contagious. We cannot catch it from someone else who has it. Hygiene has no impact on the development of vitiligo, and vitiligo is primarily a cosmetic condition that does not directly impact a person's physical health. While sunburn can trigger vitiligo in some people, normal sun exposure is not a cause. Awareness programs play a vital role in educating public about vitiligo, dispelling myths and promoting understanding. And these programs empower those with vitiligo to seek treatment, support and advocate policies for their well-being. Through these, we can provide accurate information about vitiligo, its causes and its effects. Also encourage those with vitiligo to seek treatment and support, and promote policies, practices that support the right and well-being of people with vitiligo, highlight the beauty of diversity and stories of those living with vitiligo. On World Vitiligo Day, let's celebrate diversity and the stories of those living with vitiligo. And let's raise awareness, promote acceptance, and support those with this condition. Together, we can build a more compassionate and inclusive society where everyone feels valued and respected. Thank you for listening and for your commitment to making a difference. And let's continue this important conversation beyond today and work towards a future where everyone is celebrated for who they are.
Dear listeners, that was the talk Vitiligo, Truth, Facts and Myths, delivered by Dr. Girish PN. This talk came to you from the studios of Akashavani Mangalore.